Well, if you've been following me on YouTube recently, you've probably noticed that I've been talking a lot about inflammation. Why is that? Well, it's one of the most important processes in life, helping to protect and repair us. Sometimes, though, it's harmful. And as a surgeon, my job is to understand and work with it so that you get the best outcome from surgery. But my job isn't just about doing the operations. It's the fun bit, and I love it. But there's so much more to being a surgeon than scalpels, hammers and chisels. Over the years, particularly since the pandemic, I've become fascinated by the connections between age, lifestyle, genes, hormones, and the joint diseases that I see and treat. So what, you might well ask? Well, bear with me and I'll explain. If you're still watching, you're probably suffering from generalised joint aches and pains, tiredness, irritability and poor sleep. Are you struggling to lose weight and keep fit? These problems happen much more often and are much more troublesome as we gallop into middle age and beyond, particularly in women as they go through the menopause. Now, I've been a hip surgeon for 25 years and I've seen thousands of patients who struggle with joint problems that come on as they get into their 50s. Sometimes these problems are caused by arthritis, but not always. There's increasing awareness that ageing, soft tissue and joint inflammation and hormonal changes are all inextricably linked together. If they're left untreated, they make us feel tired, depressed and unfit. We feel and often look awful. We put on weight and we start to get high blood pressure, diabetes and heart disease. We lose muscle mass and we get osteoporosis. Frailty is just around the corner, and believe me, that's something we must avoid at all costs. But for so many of us, it's really difficult to get a clear diagnosis and appropriate advice and treatment. Getting to see your GP isn't always easy these days, and referrals to a specialist can often take a long time. It's no wonder that people just put up with it and hope for the best. So what can I do to help you? Well, I'm going to start a clinic that will help people like you to get the treatment that you need. When you come and see me, you'll have a prompt, thorough clinical assessment done by an expert orthopaedic surgeon. That's me. You'll have investigations like x-rays, blood tests and scans so that we can reach a diagnosis and plan the right treatment for you. Depending on what's wrong, you'll get to see experts in women's health, nutrition and rehabilitation, whatever's necessary to get you feeling and looking great again. It's for everyone, men and women. But what's the catch? Well, it is a private service, you'll have to pay for it, but we won't recommend tests and treatment that aren't appropriate for you, and there won't be any surprises when it comes to costs. You don't need to see your GP to get a referral, you just need to make an appointment and we'll arrange everything. You won't have to wait long for an appointment, we can usually see you within a week or two at most. If you'd like to know more about this new service or simply book an appointment, please get in touch. The details are below in the description. See you soon.